Next, we will talk about the scope of pharmacology. Although there are many scope of pharmacology, but we will get to know only about five here: pharmacotherapeutics, preclinical trials, clinical trials, drug discovery, and toxicology. In pharmacotherapeutics, the person who has a study about the pharmacology and he or she has a knowledge about it, then that person can treat the patients because he or she has a knowledge that which medicine has to be given for which disease, how many quantity has to be given, and must have known about its side effects. In the next preclinical trials, the scope of pharmacology is also seen in the preclinical field. A person who has a knowledge of pharma can also work in preclinical labs, where testing of new medicine is done before use in clinical field. Next is clinical trials. Pharmacologists can also work in the clinical field. A lot of scope are seen in this. In today's time, many things are recorded in this such as side effects and benefits from new drugs. For the new drugs, drug discovery. In the drug discovery, a person who has a knowledge of pharmacology, he or she can go easily in the field of research and to discover or research many of new drugs. Next and last is toxicology. In toxicology, pharmacologist has enough knowledge that how to decrease the toxicity, means how to reduce the complicated effects on the body, and also know how to recover from that effects. Next, we will discuss about the route of drug administration. Let us know, route of drug administration is the medium in which drug is introduced into the body for its action. Route of drug administration is a medium or a pathway through which any drug or medicine is introduced inside our body so that it can shows its action, which is biological. Next, in this slide, we will learn that routes of drug administration has been divided into how many parts. So, route of drug administration has been divided into two parts. First is systemic route and second is local route. Now, first we will talk about systemic route. In the systemic route is also further divided in two routes. First is enteral route. In this, we will learn full descriptions for oral, sublingual and rectal route in further slide. Now, let's move to the parenteral route of systemic route. In this route, we will know about the subcutaneous, intramuscular, intravenous, intra-arterial and intradermal route and its advantages and disadvantages. In local route, we will learn about the skin topical, ocular drops and intranasal routes. So these are all the routes of drug administration in which we will get to learn about them in detail one by one. First, we will talk about the oral route. It is the most common route. Use of neutral drugs, form of tablets, capsules, syrup, emulsions or powders. So that means in oral route, most of the medicines are taken from the oral route along with the neutral drugs. Their route also remains oral. Here are some examples of forms of medicine such as tablets, capsules, syrup, emulsions or powders, all of which can be taken by the oral route. Now next talk about the advantages of oral route. First is easy to take. In this, oral route is a very easy and simple process because medicines can be taken well through the oral route. Second is it is a cheapest available route. It is much cheaper to take the medicines through this route. Next is no physicians required. Means to get the medicines through this route, no doctor, no nurses or pharmacist is required. Next is disadvantages. First is less amount of drug reaches the target tissue. One disadvantage of the oral route is that only a small amount of drug reaches its target tissue. Second, might cause gastric irritations. It is a second disadvantages of the oral route can be taken that what that medicines will not be reached that the target tissues completely, then slow absorptions can be happen. So due to that the chances of gastric irritations become more.